Moscow is the largest metropolitan area in the Russian Federation and the European region, with a permanent population of around 12.5 million people. The city is growing and developing rapidly, with more than 3 million people filing applications with the migration services in 2017 alone. This influx of people from different regions of the country and from abroad presents a challenge for the health system and prevention of infectious diseases in particular. But in Moscow, a well-structured and highly effective system for delivering tuberculosis services is bringing quality treatment and care to people from many different walks of life, including such vulnerable groups as migrants and homeless people.
Treatment of tuberculosis patients is one of the most important components of TB care provision to the population, and I want to emphasize it to the population, not only to citizens. That is, we don't differentiate approaches of healthcare provision to these patients.
My name is Karam and I'm from Tajikistan. I came to Moscow, worked in construction. I'm 23 years old. In Moscow, I live with my uncle. When I was at work, I experienced fever and a headache, and I had no energy left to continue working. When I was admitted to the hospital, I felt very sick. I was too exhausted. It turned out I had tuberculosis meningitis.
In addition to permanent residents of the capital, Moscow TB services cover all people who live in the city, including migrants like Karam. Professor Elena Bogorodskaya leads the Moscow tuberculosis services.
When talking among ourselves, we divide people into socially vulnerable and socially secure groups. A strategy of universal health coverage of all patients is being implemented in Moscow, and tuberculosis care is the same for different social groups. The same package and level of care is provided to all.
The modern TB services in Moscow are provided by the Moscow Research and Clinical Center for Tuberculosis Control, which comprises 2 clinics, 2 clinical and diagnostic centers for pulmonary and extrapulmonary tuberculosis, a children's diagnostic department, 8 branches in Moscow districts, and 2 hospitals for patients with tuberculosis who need hospital treatment and care. One of the first centers for the detection of tuberculosis among people coming to Moscow from abroad, including from former Soviet republics and from other countries, is the Moscow Multifunctional Migration Center. Its throughput capacity is 7,500 people per day. It's here where all the migrants who come to Moscow to live, work and study must register and undergo a medical examination.
Out of 450,000 migrants who have passed through the center in 1 year, 500 or 600 people had a pathological finding. Healthcare services to migrants are focused on providing convenience. The speed to undergo the examination and its quality are also important.
I'm
20 years old. I came from Vietnam to Moscow to study. I contracted tuberculosis and I was immediately admitted to the treatment here, TB hospital in Moscow. Now I feel good. I want to be healthy to be able to go home. Then I will come back to Moscow to continue with my education.
Moscow, similar to other major cities of the world, sees a number of homeless people. The incidence of tuberculosis among them is higher than amongst other population groups. The Moscow Center for Social Adaptation has a full-time TB physician. This center was founded to help people who are in a difficult life situation. The full range of services, from diagnostic examination for tuberculosis through inpatient and outpatient treatment as needed, is available to any homeless person who has symptoms or develops tuberculosis.
I'm 59 years old. When I injured my eye, I came to the center and was referred for an examination. All the tests, X-ray, laboratory tests, everything.
Moscow is a dynamic modern city It is attractive to people including foreign citizens in terms of study and work, especially to residents of neighbouring former Soviet republics and people from Asia and Africa. The government of Moscow pays great attention to proper epidemiologic and healthcare management in the metropolitan areas, including prevention and care of tuberculosis. Considering all the factors, Moscow's experience in this area can be called one of the best practices.
Here today we can see that health services are available to people who need it, disregarding whether they are citizens, whether they are laborers, migrants, students coming to this major city to work or study, or homeless people that we can see everywhere in major metropolis or other parts of the world.
Полгода лечения прошел, вот,
I have received treatment for half a year for free. They have treated me free of charge. I started to feel better. I don't even have a headache. I feel energized.
TB care in Moscow is free for all under the federal law of the Russian Federation number 77, and the law covers immigrants as well, as they fit under the notion of a TB patient.
Ensuring universal access to healthcare services for different population groups worldwide and contributing to ultimately eliminating tuberculosis in the era of Sustainable Development Goals are key components of the World Health Organization's strategy for extending universal health coverage around the world.
In the city of Moscow, in the Russian Federation, we can see an excellent example of that in relation to access to health services for people suffering from tuberculosis.
The enjoyment of the highest attainable standards of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic or social conditions.